Hello everyone. So today I will be talking about transdermal therapeutic systems. Uh, the content that I have taken is from Essentials of Medical Pharmacology by Tripathi. So what are transdermal therapeutic systems? So first of all, as for the definition, these are drug delivering devices. Let me just highlight this. These are the drug delivering devices which are found as adhesive patches. So in the market when you go, these will be sold as adhesive patches with adhesive coating, on top of which there is a film which will be removed at the time when we have to apply it on the skin. So what is their purpose? These deliver drugs systemically, which means through the blood vessels, through the capillaries, at a constant rate. This is very important, that transdermal therapeutic systems deliver drugs at a constant rate into the systemic blood flow via the stratum corneum. So what is stratum corneum? This stratum corneum is actually a layer of the skin that you see in this diagram. This let me change the color, it's too yellow. So this whole layer that you see right over here, this layer that I am highlighting in yellow. So what will happen is that drug which is coming, now in this diagram you can see this is the drug reservoir. This drug reservoir, this contains load of the drug that is to be delivered through this patch. So this will come down by diffusion, and this will first cross a micropore membrane which has a rate controlling mechanism. So this will cross it, and then this will reach into this layer, and this will cross this layer to reach the stratum corneum, which is this thing in red, this layer. Now why stratum corneum? Because this is a layer which is rich in lipid. So and the drug preparation that we have in this drug reservoir right over here, this is also lipid rich in order to facilitate this diffusion through this stratum corneum. So stratum corneum, that has to be remembered, is very important. Now looking at the structure, you'll see that it is made up of an occlusive backing film. The backing film is occlusive. What that means is that it is resistant. The drug reservoir contains a lot of water, right? So this water is resistant to being evaporated because there is a film. Now let me take the blue color. Now this film right over here that you have, this film is resistant, okay, that I am highlighting in blue. Let me highlight this film that we have, this film is blue. Now why is that? Now, this film is blue and it is actually occlusive, which means that it will not permit the drug reservoir to get evaporated. So that is what it does. Then we have the drug reservoir, which is the next layer that I have highlighted in red, after which we have the micropore membrane, which is this green thing right over here. This is the micropore membrane, and these arches, what are these are the pores. These are the pores in this film, and these will allow a rate controlled manner of flow of this drug to this layer. Now after which what do we have? The last layer, on the under surface of this micropore membrane, we have a adhesive layer which also has a priming dose of this drug. Now what that means is that this black layer that you see, okay, this black layer that you see, now this layer, adhesive layer, it has a priming dose. This priming dose is the first dose that you will receive when you will apply this transdermal patch on your skin. So that is what it means. And what else do we see in this diagram? You can see that there you have these capillaries, which is these are responsible for the systemic flow of the drug. Okay, now this is the structure. So in this diagram, which is the patch, in this diagram, this whole thing in red, this is the transdermal patch, or this is the transdermal therapeutic system. Okay, so now the working principle. On what principle does this work? Let me shift my pen thickness back to what it was. So the working principle on which it works is that first of all, there is a micropore membrane, which I said. So this micropore membrane has a rate of drug delivery which is actually much slower than the slowest rate of absorption from the skin. So throughout the skin on the body, there is a slowest rate of absorption, and if the rate of drug delivery is slower than that slowest rate, which means that the rate of drug delivery is actually uniform, because it is slower than the rate of absorption. So what happens is that this uniform rate compensates for the variations of absorption rates. So there is uniform rate of absorption due to the uniform rate of drug delivery, leading to the constant drug delivery irrespective of the site of application, because we know that site of application can be variable in this case. So I have written some sites of application here. These can be on the chest, the abdomen, the upper arm, the lower arm, the buttocks, and the mastoid region. These are the potential sites of application of these transdermal patches. And also due to this constant drug delivery, there is a constant plasma concentration of the drug, which I have written. So let me see here. So which actually serves as an advantage, that there is a smooth constant plasma concentration and which does not fluctuate. Why does it not fluctuate? It does not fluctuate because there is this constant rate of drug delivery. Now what are the other advantages of these transdermal patches? Because these will have some advantages, then only we will use this in place of tablets and capsules and all other methods of administration of drugs. So this can actually last for 1 to 3 days, because you know that the rate of drug delivery is so slow, so it will last for such long time. And that is why in India these are actually used quite widely as nicotine patches. These are actually quite popular in India, in USA, and in other regions. We also have fentanyl patches for pain relief, and the estradiol patches. And then these are more convenient as compared to, for example, injections or tablets. If the patient is non-compliant or if the patient is vomiting frequently, so it has better patient compliance because it is more convenient. Now the disadvantages. Now, since we know that these can last for 1 to 3 days, hence prolonged application of these can cause the irritation of the skin or the erythema. Now, what is erythema? This is nothing but the localized reddening of the skin due to the localized dilatation of the capillaries in the skin. Now, this will not always occur, only occurs in some patients. Hence, so many advantages and so better patient compliance. This can also be minimized by changing the site of application. So this is not that much big of a problem. Now, due to these problems, these can have to be discontinued in some of the patients, about 2 to 7% of the cases. Now, the notes I have linked in the description. You will get those there. So that's it. This topic is very important for the exam, so you must remember it. Bye.